Welcome everyone to today's webinar, Responsible AI, Streamlining Care Enterprise-Wide. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, here are a few quick housekeeping instructions. We will begin today's webinar with a presentation and have time for questions and answer at the end. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. If at any time you do not see your slides moving or have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. To learn about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. With that, I am pleased to welcome today's moderator, Prem Bachu Green, Vice President Clinical at Viz AI. Prem, I'll turn it over to you to get us started.
Thank you so much. Very excited to be here today. We have some amazing speakers that are going to share their insights on this topic with us. I would love to introduce you all to Dr. Snehal Gandhi, who is the CMIO Medical Director, Division of the Hospital Medicine at Cooper Medical Center. Dr. Gandhi, would you like to share a little bit about your health system?
Sure. Cooper University Healthcare is in South Jersey. It's located in Camden, New Jersey, right across from Philadelphia. We are a level 1 trauma center. We're an academic medical center. We're affiliated with Cooper Medical School of Rowan University. So we have essentially almost every specialty, and we're very interested in technology and just adopting things from a technology perspective that can help both our patients and our staff.
Wonderful. Thank you for joining us today. We also have Alex Wasserman, who is the Corporate Director of Business Continuity and Informatics at Jackson Health System Miami. Alex, would you like to introduce yourself and tell us a little bit about your system as well?
Absolutely. Good afternoon, and thank you for having me today. Jackson is the county-based hospital with a 106-year-old history of serving the greater Miami area. We're a Trauma One Center affiliated with University of Miami School of Medicine, providing wonderful academic and county-based education for the future medical students. So super excited to be here today.
Wonderful. Both amazing systems that we have the opportunity to work with and hear from today. Great. Before we get started with our questions for Dr. Gandhi and Dr. Wasserman, I'd like to take a minute to go over Viz AI One. Viz AI One is an enterprise platform solution that is focused on improving care gaps and workflows within health systems. Our system of action is meant to detect disease earlier, accelerate clinical action, direct patients to the right clinician, and increase access to life-saving treatments. We do this by ingesting live data from various imaging modalities and the EMR. Our Viz cloud-based AI algorithms then run in the background, detect suspected disease, and provide an alert to the appropriate care team members to then make an informed decision about the next best step and plan of care for those patients. This allows Viz to be at the point of care of that patient where decisions are made in a timely manner and we're able to engage and improve patient outcomes and provider experience. The Viz One Enterprise solution has multiple different modules. We have offerings for care pathways within the neuro suite, the cardio suite, vascular, radiology, and trauma. Viz is currently implemented in over 1,600 hospitals and health systems. We have 13 FDA-approved algorithms. We were first to receive de novo FDA approval for AI in 2018 for our neuro algorithm for large vessel occlusion. And we were first de novo FDA approval in cardiovascular in 2023 for our hypertrophic cardiomyopathy algorithm. We're proud to say that we have more than 100 publications that support the real-world impact of implementing the Viz AI technology in these health systems. We've been able to demonstrate a 2x increase in treatment rates, a reduction in time to diagnoses and treatment, and improvement in meaningful patient outcomes. Okay, I'm going to transition to our discussion with Dr. Gandhi and Alex Besserman so they can share with us how they've brought in technologies such as Viz AI and their experience with evaluating AI vendors. I'd love to turn it over now as we start and talk with our guests here to share a little bit about all of the attention that's focused on in AI in healthcare. Our goal today is really to ensure that we can understand better what all the considerations are as health systems like Cooper and Jackson Health are evaluating different technologies, and what are some of the key things that are top of mind to Dr. Gandhi and Alex as they bring in new technologies to their systems. We know that a lot of these large health systems are often faced with many challenges, and we want to consider the fact that there's needs across all of your different physician stakeholders and your different service lines. I'll start off with a quick question, Dr. Gandhi. At Cooper, can you share some of your thoughts on how you're growing the adoption of AI in healthcare and some of the concerns that you think the industry should be aware of?
Certainly. So the attention on healthcare AI with respect to healthcare and the healthcare setting, it started even before the COVID-19 pandemic. There was already growing interest in it. Obviously, during the pandemic, the focus was on the pandemic itself. But then subsequently, the interest has increased at a very rapid rate, almost an exponential rate. A lot of the focus has been around how to improve efficiency and workflows for the staff, the clinical staff, the operational staff. What is it that we can take off from them, from that they're doing manually that we can automate, but also from a perspective of how can we improve patient outcomes, patient experience. So those are some of the things that we're looking at, and that other institutions are looking at. Obviously, there's always concerns around this. Anything that we look at, we always evaluate for instance, like bias and fairness. For example, AI models can perpetuate biases that may be present in the training data. This may lead to disparities. That's something that we look at always, from an ethical and regulatory consideration around patient consent, security, privacy. Is the AI model transparent? So those are some of the things that we focus on.
Yeah, absolutely. I think being able to ensure that your vendors that you're selecting have the data to support that diversity and equity in their development of their algorithms is always top of mind, I can imagine. Alex, anything to add from your perspective there?
Absolutely. Actually, echoing Dr. Gandhi's comments, we are no longer in the AI infancy, so to speak. I think we're at the time where AI is at the applied stages, and hospitals are looking to leverage existing research vendors and bringing AI into the forefront. So for us, being a county hospital serving the underprivileged patient population in Miami, prioritizing those ethical and equitable and inclusive AI applications is a priority. It's a requirement, and looking for vendors that are our business partners, we're obviously emphasizing those core principles across the service lines.
Great. Alex, I guess to add to that, how do you also think about protecting patient data? I know that's a top of mind for a lot of administrators as well.
Yeah, absolutely. I think that's a very hot topic, and the one that generates a lot of discussion. There is a sometimes lack of industry standards when it comes to protecting AI data. So we're very happy to work with Viz AI that has decided to voluntarily test for SOC 2 compliance. And again, that is a mandatory requirement for us working with vendors to ensure that patient data is protected. It's the only ethical standard that there can be. So we do a lot of work with local and state legislature to advocate for rigorous standards when it comes to protecting patient data. And I think we have positive momentum. We had there was a symposium last year done at Harvard Medical School where a lot of policy decision makers, politicians from both sides of the aisle came to talk about what should be done regulating responsible AI in healthcare. What rules, laws, and local statutes should be in place to protect the patient's how do we avoid implicit and explicit biases in selecting AI vendors and data sets. So a lot of work is underway. I'm excited to be part of it and look forward to seeing the results.
Absolutely. Dr. Gandhi, anything to add there around the patient data security?
No, I agree. Patient data security, confidentiality is of the utmost importance. And, the vendor that we partner with, if they're doing auditing, they're making sure that the necessary controls are in place so that only those who need access to the data have access to the data. If they're doing regular penetration testing, right, they're transparent about their security and their protection. They're using data encryption, both in storing the data and also in transmission of the data. Those are also things that we look at because our patients and everybody has an expectation to that, and we want to live up to those expectations.
Yeah, absolutely. It's good that you're keeping that top of mind as you're looking at these solutions. How do you address? I can imagine that a lot of your different physician groups come to you with requests to bring in different AI technologies. How do you evaluate those AI vendors, and what are some of the considerations you think about when you've got multiple requests like that across your system that come in?
Yeah, so always we always get requests from the various groups, not just the physician groups. We get it from the provider groups, we get it from the clinical staff, we also get it from the non-clinical staff.
Yeah.
And one of the things that we always do is what priority is what priority does the project take? Is it something that is a must-have? Is it something that is a nice to have? We don't just implement technology for the sake of implementing technology. We look to see if there's a use case scenario. So we always go back to people, process, and technology. Who are the people that are involved? Who are the stakeholders? What is the current process? What is it that we're trying to improve or trying to make better for that matter? And then we go in and we layer in the technology. With the end users, such as the various groups that put in the request, we always ask them a question: what is it that the problem that you're trying to solve? What is it that you're trying to get from a KPI or outcomes perspective? So we have a robust process from that perspective. And then what we do is, again, we go in, we prioritize it, we set expectations with the end user saying, hey, this is the time frame that we're looking at and everything. This is what we need from a budget perspective, whatnot. It may not be in their budget. In that case, we evaluate, is this something that we want to do now, or is this something that can wait till later? And also a lot of education, not just around, the change management process, but also the entire implementation from a project perspective. Relative to AI, we're doing education on AI. We're educating people on AI. So, we're trying to equip the end users in terms of for them to help them understand, what is something that would be beneficial to them and to the organization and to our patients, and what is something that they can pass on.
Yeah, absolutely. Alex, any additional thoughts for you on that?
Yeah, a few comments. I think what we've seen is the high-performing organizations have moved into adding AI into their strategic plan. And for that to succeed, you have to have a foundation. So there is a AI governing structure that people are establishing along with managing data. And that's great to see, because that's where the rubber meets the road. Similar to what Dr. Gandhi mentioned, what is the organizational priority? Can we leverage AI to achieve the top 5 things that we're aiming to do? And not only clinically, but fiscally and patient experience-wise. So going beyond the traditional realm of using data in the radiology suite of products, can we have a scalability to go into cardiology, to go to the emergency medicine, to decrease patient wait times? Can we do remote monitoring to the rural communities that we serve? So those are the things that are coming to the forefront once you establish a robust AI governance and add the particular AI data points to the strategic plan. And owning it, I think our executive team understands the benefits of AI, but there's still a lot of rumors out there. So that's where the experts need to come to the table and really demonstrate that, just like any other research in medicine, if the vendor has conducted randomized controlled trials, that's the vendor that you seek. That's the trust factor that you develop. Are they peer-reviewed articles, or is it anecdotal data? So there are different methodologies to evaluate AI vendors and select the best of the best for the betterment of the organization and the patients.
Yeah, I think what you said there around the real world evidence that's available, the different types of publications and abstracts, is such an important area to consider, because what's submitted to the FDA, right, may be very different than what actually plays out in the real world. How do you feel that the vendors that you're partnering with today, what do you look for, I guess, in the depth of their studies that you said? You talked about a few of the different types of studies there, Alex. Anything else that you would look for in those publications that really speak to how the technology may be implemented, how that impact could look like across your system, that really stand out as you're evaluating that evidence that's available?
Yeah, absolutely. I think you have to look for transparency in the research to make sure that the AI vendors and the algorithms are actually benefiting the patient. Again, we've dealt with a lot of products that help us select less costly imaging services. But at the end of the day, the ethical question is, will it benefit the patient or will it benefit the system more? So asking the right questions, having the right stakeholders at the table to say this, in fact, is AI-driven improvement for patient safety because we're predicting sepsis. We're using algorithm to decrease mortality. Those types of things usually have a greater acceptance by the medical staff and the executive suite. So yes, there are methodologies that we use, and not all AI vendors created equal, unfortunately or fortunately. So again, we look for that transparency, for evidence-based practice behind it, research backed, and those are the criteria that we use.
Wonderful. I think the key to that too, a big buzzword that's out there today to help with evaluating AI technology is implementation science, right? And I think it ties back, Dr. Gandhi, to exactly what you were saying in terms of being able to understand how the technology is implemented, what are those metrics that you're measuring for, and how do you go about doing it, right? Do you feel today that your vendors that you're partnering with are able to support you and guide you, and how closely do you partner with them to be able to evaluate that?
We partner very closely with them. When we engage with the vendor and we partner with them, this is our expectation in terms of transparency, in terms of them showing the data. If they have implemented at other organizations, then they have to show us what kind of outcomes. We'll call the other organizations that they've given to us as references, and we'll engage with them. And then we have a community here of CMIOs that I reach out to see if anybody else has experience. So there's a lot of pre-work that goes into it before we partner with the vendor. I can tell you that there are times where a vendor comes forward and initially it seems like they may be a good fit for us to partner with. And then it turns out that after doing some due diligence, we find out that they may not be such a great partner. And so we pass on them at that point. In other respects, we do developmental work. So for instance, there may be a company out there that has something that's brand new that they're willing to, they need to get into an organization so that they can partner with the clinicians, collect some data. And we're happy to do that too, recognizing that, from a literature standpoint, we'll do a literature search, we'll go out and we'll see what's out there. We'll see, if other people have done something similar. And if it looks like it may be beneficial or there may be positive outcomes, we certainly will partner with them and we'll help them collect the data, which is mutually beneficial to us in the organization and to our patients, but it's also beneficial to the company. So there are times where we will do that too.
Wonderful. I think that makes it even better because you're allowing that solution to be customized to your system and the needs of your providers, right?
Right.
One of the things that I'd like to bring up, I know Dr. Gandhi, Cooper has actually partnered with Viz to implement all of our algorithms across the enterprise, which is really exciting for us. I'm sure selecting one vendor to help adopt that suite of AI solutions was never an easy decision, especially across a large system like yours. What led you to this decision?
So this is something that, we're currently evaluating. And the reason that we're headed in that direction is because Viz has been a fantastic partner to work with. From the get-go, they've been very engaged with us. It's not like, hey, you signed the contract. Here's the software, call us when you need us. We've had regular meetings. We have physicians who are very engaged with Viz. And constantly give feedback, and that feedback is incorporated into enhancements or further development. And so we initially started with one module, and based on our experience with that initial module that we started with, and seeing what that partnership was and how well it was working, we gradually added other ones. So to the point where now we're exploring the Viz One solution. What's important to us is the ability to scale up, implement, the ability to add additional algorithms that can meet the clinical needs, show some economic value in the long-term, reach across different specialties. That's important to us, and Viz has been able to demonstrate that.
That's great. And I know our teams are always looking for being able to partner with you and your physicians, because it allows us to really help drive and share some of that impact that we can have across Viz AI One and the platforms that we've deployed there. Alex, I know you have experience as well that's related to implementing Viz AI. Would love to hear your perspective on how that's gone, and what are some things that you can share around learnings and successes that you've had through that process.
Yeah, absolutely. I had a pleasure of having a few years of experience working with Viz AI and different organizations, and can definitely attest that we have a wonderful bi-directional relationship with Viz, and the people are engaged. They're seeing the value, they're seeing the evidence behind it. They believe in the power of AI now. Again, it's cautiously optimistic. Most meetings with the medical staff, when you bring AI and the change management occurs, it's a cautiously optimistic, borderline, I don't want to believe into it feeling. So when you are able to present the data from similar organizations, especially well-known in the country, it makes a world of difference. When you present the results of the studies that are published and FDA-approved algorithms, it makes that cautious optimism blown into a fully expandable change management process where people own the steps of the process. And again, it helps to have an operational system behind it, because AI at this point, like I mentioned before, is applied. So without having a robust process in the hospital system, it's very difficult to implement changes associated with AI. So very happy to say that it has been proven and done in both radiology and cardiology suites of products, and looking for scalability into other areas. So again, the future is bright. Having the right vendor is the key, but having an engaged right vendor is even more important.
Absolutely. And you spoke a little bit, Alex, about radiology. Some of the recent data shows that the majority of the FDA-cleared algorithms are radiology intended, right? Is that what you're seeing as you're implementing AI through your system? Is it primarily in the radiology field or elsewhere as well?
Yeah, it's sort of a low-hanging fruit for a lot of systems, because there's so much data in the imaging system waiting to be picked up and analyzed, and the goal is saving time. So why do you bring AI into imaging? It's because you can diagnose, recognize the problem much sooner. If we're talking about acute stroke patients, the goal is to bring the patients to the table as soon as you physically can. So having an AI-driven algorithm saving minutes is ultimately turning into saving lives. And that's, again, presenting it to the board meetings and executive teams is an easy feast, because you have evidence behind it, that if we are able to save minutes from the moment they arrive to the emergency department to the time we take them to interventional radiology, that's proven to make an impact on the outcomes and the mortality and the length of stay. So that's the language that people now understand, that there is economy of scales behind it. It's not a science fiction any longer. It's applied AI in imaging.
Yeah. And I think one of the things that you said that really stood out there, Alex, is the fact that you need to have really engaged stakeholders, right, to make the AI as effective and optimized as it can be and within the workflows. Dr. Gandhi, how do you engage your teams as they're bringing in AI to make sure all of the right stakeholders are at the table? And what are best practices that can be used to get alignment there on workflows?
So it's always about communication. It's education and communication. And before we even embark on a project, we make sure that all the necessary stakeholders are involved. We have agreement from them that they are going to be actively participating. That we also have agreement from the organizational executives that this is a strategic initiative that we want to implement. We set the timelines and everything, and we make sure that there's time allocated to making sure that the project is successful. So again, that comes down to a lot of due diligence, a lot of pre-work, and we make sure that that's in place. And so my team from medical informatics, we work synergistically with IT. We work with the other areas. And so before we even embark on a project, we establish like, hey, this is going to take this much time. This is the involvement that we need from the clinicians, from the physicians, from the APPs, from the nurses. This is the amount of time that we need from the other groups. Outline all of that within the project plan and everything, and make sure that we have the commitment so that we give the project the best chance of success.
Yeah, absolutely. And I think one of the points you made earlier is understanding what you're solving for. And if you're truly solving for something, all of these stakeholders are willing to come to the table because it's hopefully helping them in their day-to-day and their workflows, right?
Absolutely, absolutely. And a lot of times when you engage the stakeholders in that manner and you educate and you communicate and you involve them, they're very interested. Oftentimes people say that clinicians are averse to technology. I always say that clinicians are averse to incorrectly or wrongly implemented technology. Clinicians love technology as long as it's implemented correctly and it's beneficial to them from an efficiency standpoint, from a workflow standpoint, just from reducing their cognitive burden. They have so many things to do. How can we help them out? And especially most important of all is that we have great patient outcomes. We want to show great, if we can improve the patient outcomes and the patient experience. That's very important.
Yeah, absolutely. And that's where I think exactly what you said in making sure that you have those metrics identified early, so you can measure whether it's patient outcomes, time to treatment, what have you, and ensuring that the right metrics are being moved across the implementation cycle.
Right.
This is great. I think this is such an amazing conversation. I think you both brought up such great topics around thinking through not only data security, privacy issues, but also understanding accuracy and performance of different algorithms that you might be bringing into your system as a part of your AI solutions. I know that it's always a challenging decision to make, especially when you're moving in the direction of identifying one partner that might have all of those solutions. With lots of AI vendors out there promoting those solutions, there's a lot of factors to consider. We thank you both for being here with us today. Thrilled to hear about your experience with implementing Viz. I think your expertise in sharing the best practices and considerations for interoperability and how you decide through your AI governance committees is very important. We do have a few questions from some of the participants that I'd love to ask as well. A few questions that came up in the discussion were, how is AI being applied to member issue case management and resolution? Dr. Gandhi or Alex, who'd like to take that one?
I imagine that this question is probably related to more like insurance or payers. And, just from my contacts and from people in the industry, what I've seen and something that we're also looking at over here in a different context is using AI to, again, go back and make the workflows more efficient, streamline the processes, improve satisfaction. So, for instance, if cases are coming in based on the complexity or the urgency of the case, AI can help with triaging, automated triaging and routing so that it gets to the correct person on the initial try instead of, getting bounced around multiple times. Perhaps using, for instance, predictive analytics to identify patterns in member issues. That's another thing that comes to mind. Maybe even enhancing decision support so that if a member presents an issue or some complexity based on what the member is presenting, the AI can look through the historical data and maybe suggest a solution, to the problem that is being presented. So those are some of the things that come to mind.
Yeah, those are definitely exciting areas that continue to grow as well. Alex?
Yeah, I think I would add that I think there's an untapped potential for AI in the case management world. And I think the goal is to eliminate friction, delays, and ultimately decrease the length of stay with the optimal discharge from the patient to appropriate facility or home. So it's how AI vendors are integrating with EHR ecosystem to leverage the data that we have, because we have a lot of redundancy. Most healthcare systems are facing with the same dilemma. I have a lot of data, but I don't have enough useful data presented to me to make a decision, whether you're a physician, nurse, or case manager.
Yeah, I think about how much more seamless that discharge planning would be for those patients to make it more effective for them. Yeah, that's a great use case. Another question that we have from our registrants here are, how can IT teams best deal with pressure from departments to move faster in implementing AI? I'm sure IT is overburdened all day with the multiple requests that come in, and being able to prioritize those is probably quite the challenge, even to allocate those resources. Dr. Gandhi, what are your thoughts on that?
So first thing, yeah, there's a lot of, and they get requests every day. Certainly our IT department does, with everybody coming forward and saying, hey, can we implement this? Can we buy this? Can we get this? I think first and foremost is, fortunately at Cooper, we have an IT department, but we also have a separate division of medical informatics where we have board certified clinical informaticists, and we also have full-time clinicians that are working within the division. And so we work very closely with IT, and it's very important in the sense that we help vet those requests, because a lot of the requests come from the clinical areas, from different physician groups or provider groups, because they're being approached by the various vendors saying, hey, I can help you with this. We have this AI solution that's specific to your specialty. So we work in conjunction with IT to vet many of those requests out. Along with that, educating the stakeholders about the complexities involved in AI projects, as we mentioned previously, in terms of the ethical requirements that are there, data transparency of the algorithms, making sure that the data is secure, private, there's privacy considerations. We set realistic expectations about timeframes for implementation. I mean, again, it comes down to, is this a gotta have it, must have this year? Is this a nice to have that we can look at? Prioritization of the projects via governance. We have governance committees, so it gets fed through, and how do we prioritize these projects? In order to move things faster, we have adopted agile methodologies at Cooper. So that's one thing that we can cut down on timelines. And we do a lot of pilot programs, quite honestly. We do pilot programs to see if the juice is worth the squeeze. So, and then based on the outcome of that pilot program, where we look at the outcomes and everything, we can say, hey, is this something that we want to deploy throughout the institution?
That's wonderful. Alex, I know you've got some thoughts here too on how you've done this at Jackson Health.
Yeah, very, very lucky to have a super strong and productive IT collaboration with our teams in IT department and the visionary leaders that have established the IT governance. So I think that's the key. The number of requests will not decrease over time. As a matter of fact, it's probably quadrupled since pandemic. So having the robust system of intake, allowing the end users to intake all the details of the request, including regulatory fiscal details, and filtering through the clinical informatics eyes, so to speak, to have a clinician who is bilingual, technical, and clinical. It helps tremendously to eliminate long waits and prioritize requests, as Dr. Gandhi mentioned. That's really a goal number one. How do you pick low, high, medium priority? What's the SLA behind it? Do we have an expectation for things to be done in a certain time frame? Those things are key to success organizationally. And again, I am just very, very happy that at Jackson we have such a wonderful working relationship with all our T teams and our medical informatics and our CMIO, making things possible for us.
Yeah, I think what I heard from both of you around this, right, is the fact that it's very, very important and critical that your stakeholders understand the impact this is having, even on your patients, the population that it's impacting. So you can think about the size of the impact that you'll have to help prioritize that as well. All right, one other question that we have from the audience was, how will AI impact allied health staffing requirements for strikes or travel contracts? Dr. Gandhi, would you like to go first?
Sure, I can take a stab at this. So again, I think it comes down to predictive analytics. If you have an AI algorithm that can look at, your historical staffing numbers, for instance, and other current factors or environmental factors, that may help in terms of, giving you some ability to see, what your staffing requirements are in certain situations. I think that from a staffing perspective, like if I look at staffing from a physician perspective, we have ups and downs in census, for instance, patient population within the hospital, outpatient visits, et cetera. If the AI can take all of those factors or a lot of those factors into consideration, we can reduce the burden of scheduling by at least coming up with some automated scheduling and deployment of staff. And I think that the AI can help there.
Yeah, we always hear a lot about staffing issues, especially after the pandemic. And I think in even areas where there's shortages, right, of staff or specialties, in terms of being able to fill the gap that's occurring. And hopefully AI can also support with some of that to just improve efficiencies for the teams that are there to support. Alex, what are your thoughts on that?
I think the future should be where AI helps us generate an acuity score that will drive the staffing ratios that hospitals use. One of the benefits of AI is to prevent the burnout. Provider burnout is real. Having the SME, subject matter experts, at the table, talking with vendors, discussing their pain points is, in fact, the best way to move forward to address those.
Yeah, that's a great point, Alex. I think the data is as good as it is without understanding how to make it actionable, and really thinking through what the impact can be and what you're looking for. It needs to be really clear as you're looking at implementing solutions and understanding, back to what Dr. Gandhi said earlier, what exactly is it that we're solving for, and does this move the needle, right? Does AI help us solve this? I think that's great. Any additional thoughts from both of you as we're closing? I'd love for Dr. Gandhi and Alex for you to summarize, as you're evaluating AI vendors, what are the top 3 things that you run through in your mind? And what should that will help our registrants take this away as well, as they're thinking through kind of the checklist of here's what we need to work through.
So, for us, implementing AI in healthcare, obviously multifaceted. I would say that the top things that we look at are improving clinical outcomes, improving workflows and efficiency while eliminating waste in the form of reducing costs.
Great. Alex?
Yeah, I think we need to agree that AI is no longer a luxury, but more of a necessity, which will not replace the way we practice medicine and nursing, but it enhances what we do. And once we embrace that notion, I think we concentrate on things. How do you pick the right vendor that matches the organizational culture? And for us, it means someone who is evidence-based, rooted in evidence and peer-reviewed work. It's someone who protects patient data securely and has efficacy behind the company. And I think it's a scalability of AI algorithms across the service lines, from imaging to cardiology to emergency medicine and beyond, and into preventive medicine, because I think that's the future for all of us. We don't do enough work preventing patients. So, I'm looking very, very curiously into the future.
Wonderful. Thank you so much, Dr. Gandhi. Thank you, Alex, for your time today. I think you left our audience with a lot of great thoughts as they are considering implementing this AI technology into their systems. Viz AI One is an AI solution that definitely extends across the enterprise. We integrate multiple clinical disciplines to help expedite diagnoses and treatment. That's really the goal, and we're driven by improving patient outcomes. We partner with physicians like that you have at your sites to really ensure that we're solving for the right challenges and gaps in care that they have. So we can demonstrate impact not only across clinical, operational, but also economic impacts for all of your patients across the board. Thank you again for joining us today. If there's any more questions, please, to the audience, feel free to reach out to us. VizAI.one is our platform solution, and VizAI.com is our website. Have a great day. Thank you.